Good afternoon and welcome to The Heart is a Lady Part. I'm Dr. Tara Narula, a cardiologist at Northwell Health and a member of the CATS Institute for Women's Health. And I'm here today with my colleagues to speak about taking care of your heart. There are many elements in life that only women face, and there are risk factors that have special importance for women. We've assembled a group of experts to examine these issues and provide you with the information you need to make the best decisions for your heart health. With me today are cardiologists Dr. Jean Cachabaudo and Maria Avila, along with psychologist Dr. Bella Grossman, who are all part of Northwell Health's CATS Institute for Women's Health. We'll be talking about how your emotional well-being impacts your heart health, the real connection between your heart and your brain, and the special risk factors that impact women. So I'd like to go ahead and have my guests say hello and introduce themselves, and then we'll launch right into our moderated panel.
So I'm Dr. Jean Cachabaudo. Tara, thank you for the lovely introduction. It's great to be here with all of us. I am a cardiologist, and I am also a medical director at Huntington Hospital on Long Island. Really delighted to be here.
My name is Maria Avila. I'm also a cardiologist. I work at Northwell University Hospital, and I'm specialized in advanced heart disease with patients with heart failure. I'm super excited to be here. This is a great opportunity, and I think we're gonna learn and have fun as we discuss important topics.
And hi, I'm Bella Grossman, and I'm a clinical psychologist working at CATS Institute for Women's Health, and I work to help integrate care into the medical setting because our mind and our body are connected, and it's so important to be able to be looking at the whole person, and I'm so excited to be here today, so thank you.
Thank you so much. And so without further ado, I want to start with you, Maria. You know, a lot of women think about breast health, for example, and the risk of breast cancer. But what exactly is the risk to a woman of cardiovascular disease? Can you tell us a little bit about that?
Sure. I mean, that's a great question. Heart disease is often thought to be more of a problem for men. However, we know that it's the most common cause of death for both women and men, at least here in the US. And around the same number of women and men die each year of heart disease. I think one of the biggest problems is that because some of the heart disease symptoms in women can differ from those in men, women often don't know what to look for. So we know that women are at high risk of heart disease. So we all have to learn what are risk factors that I know that we're going to discuss later on and how to prevent heart disease.
Thank you so much. And I think it's always important to emphasize that fact, leading killer of women in this country, cardiovascular disease. And you mentioned risk factors. Jean, I want to ask you, we've seen a decline in cardiovascular death over the years, which supports the idea that cardiovascular disease is preventable, but risk factors for cardiovascular disease really haven't changed. So can you tell us a little bit about what are some of the risk factors for cardiovascular disease in women?
Absolutely. So that's a great, starting point for us is that, we can prevent this disease if we get it right. And getting it right starts with knowing our risk. And so I hope everyone leaves today with being empowered with information to go have some really good conversations with your doctors. But the traditional risk factors that we've known about, honestly, since the 1960s when the Framingham Heart Study first came out in Reader's Digest, actually, and it identified that, they may have gotten it wrong because they came out and said that it was a disease of men. So men had this problem. Getting older was also a risk factor. Tobacco use, high blood pressure, high lipid levels, including cholesterol and some of the subparticles that we talk about, the HDL, the LDL, triglycerides, and also diabetes. Those are what I would call our traditional risk factors, and they still exist today. We do know, as Maria just shared, heart disease is a woman's problem. It's why we're here today. And so the gender thing has kind of been taken away, it's a risk of all of us as we get older, leading cause of death in all categories. So those are the traditional risk factors. We also talk about emerging risk factors, and the emerging risk factors all kind of wrap around this idea of inflammation. And so markers of high inflammatory states, high CRP levels, high or diseases associated with high inflammation, collagen vascular disorders like lupus and rheumatoid arthritis. We are finding that these states are also a risk factor. Recently, we've seen what feels like a rash of young women having heart attacks. I don't know if that's statistically significant or the media telling a story that needs to be told, but at the root are definitely women risk factors, and they all wrap around the idea of inflammation. So I think it's commonly accepted now that coronary artery disease, atherosclerosis, is an inflammatory disease.
That was great and so informative. And I think one other thing that we don't often talk about is what happens during pregnancy as a marker of future risk for women. Maria, in your practice, do you find that a lot of women are aware that pregnancy and what happens during pregnancy can be a marker of future risk?
I think in general, some women are aware, but there definitely needs to be increased awareness. I don't think we recognize all the changes that our body undergoes during pregnancy and how these can affect our cardiovascular or risk of cardiovascular disease long term. So I think definitely we need to continue efforts to increase the awareness of all the risk of and changes. Also what Jean was talking about, inflammatory changes that may affect our risk of eventual cardiovascular disease. So I think there's just still a lot of work that needs to be done in that area for sure.
Definitely. And Bella, one of the other things I find in my practice is that patients are often unaware of how what's happening up here and their mental well-being is so tied in to their cardiovascular health. So can you talk to us a little bit about how emotions impact the well-being of the heart and heart function?
Yes, definitely. So I think one way to understand about how emotions impact our heart is by looking at what happens to our bodies when our bodies are stressed. And so when our bodies are stressed, it goes into what's known as the fight or flight response. So our bodies prepare us for danger by releasing different hormones, cortisol and epinephrine being two of the main ones. And when that happens, our heart rate increases, our body mobilizes the sugars in our body to give us more energy to keep us safe. And so that's helpful for us when there is danger. But the problem happens is that this fight or flight response can happen when there's real danger or even just the anticipation of danger. So just thinking about a stressful scenario can get all those hormones to start being released. And if it's being released all of the time, that's going to be problematic. So both from a perspective of when you're worrying, it can start to release, and also when people have chronic stressors, like if they're a caregiver or have a chronic illness or another kind of stressor that's continually occurring, our body doesn't get a chance to rest, and we're continually releasing all of these hormones, which can, in the long term, impact our health. And so what then stress does to the heart, and Jean and Maria and Tara, if you can correct me about the medical standpoint, but what happens is that if our heart rate is increased, this increases our blood pressure, and then our heart and our body starts to think that we need to keep this blood pressure elevated, which can then impact and damage our arteries, and it can cause our heart muscles to thicken. Also, Jean, as you were talking, right, inflammation is not good for our bodies and our heart, and stress and cortisol and epinephrine, it can increase these inflammation markers in our blood and in our bodies, which can do damage to our arteries. Stress can also make us do unhealthy things, right? A lot of people cope in negative ways by eating unhealthy, decreased exercise, and cortisol and epinephrine can also lead to the release of triglycerides and free fatty acids, which can increase our cholesterol. And so combined, unchecked stress can lead to an increased risk for heart disease, heart attack, and stroke. So that's kind of one area I wanted to focus on, to look at how stress or these emotions can impact our heart. Another thing I think that's really helpful to kind of look at when we're looking at the impact that our mind can have on our body and our heart is when you look at Takotsubo cardiomyopathy, which happens, it's also called broken heart syndrome. So it happens when we have an intense emotional or physical stressor, often like a sudden death of a loved one, a sudden illness, a car accident. So some really big stressor that happens. And then our heart, it can look like we're having a heart attack, but really it's just the surge in those hormones, which kind of stuns the heart and then makes that left ventricle not pump as effectively. And interestingly, it's almost 90% of reported cases are in women. So this happens a lot of times in women. But the good thing is that, and correct me if I'm wrong, that a lot of people, their heart functioning can get better within a month or two after the stressor is relieved or removed.
Thank you so much. And Maria, you must see some of these patients in your practice, heart failure, who have Takotsubo cardiomyopathy.
Yeah, definitely. As Bella mentioned, is, mostly seen really in females. And a lot of the times the stressor is emotional stressor. And these patients may present with anything ranging from mild symptoms versus someone being very sick in an ICU with a very weak heart. Now, the good news also that Bella mentioned is that prognosis is good. There is recovery as these stressors are relieved or removed, but there's also risk of recurrence. So it's important to learn ways to cope with the stress so that we can prevent these recurrent events. I think mental health, as we have discussed and will discuss further, is key to prevent cardiovascular disease.
Yes, it's all tied together. I remember at Stanford when I was in college, I had a professor of biology who wrote a book called Why Zebras Don't Get Ulcers. And it was all about this premise that biologically we're wired to have a stress response to help us flee from a lion or flee danger. But in the animal kingdom, we turn it off. And unfortunately, as humans, we don't, right? And we leave it on all the time. And it has a myriad of negative effects and consequences on the body. So moving on a little bit from stress, I want to jump back to you, Jean, and talk about kind of the progression as a woman ages. We know that as women move through their life from adolescence to mature women, we always have to pay attention to our heart health. So what can we do at each of those phases of our life to remain heart healthy?
So I think it starts with an awareness. And that is such a CATS question, because the CATS Institute for Women's Health kind of looks at women's disease in the lifespan. So adolescent, childbearing, menopausal, and then mature. And the truth is cardiovascular disease lives in all four of those domains. We talked a little bit about pregnancy, but let's start with adolescence. Coronary artery disease, atherosclerosis, plaque buildup starts in your teens. I think most people would be very surprised to hear that. Typically, by the age of 17, you can see plaque buildup in the arteries of the heart. And that's old data before the prevalence of childhood obesity, rising rates of child onset diabetes, the type 2, the one that's not the diabetes with lack of insulin, that's type 1. As we see increased incidence in this, I think it's going to translate into more premature cardiac events. So prevention starts, honestly, when you're a kid. I think most of us here are moms. I always thought about that, raising my children and trying to get them to embrace the idea of a colorful plate when they make their meals. Half of it should be colorful. It should be, fruits and vegetables and reds and yellows and oranges and greens and, a little bit of beige, which is that's what my kids love, the French fries, the chicken nuggets and stuff like that. So let's get some good habits started early on. We talked a little bit during the childbearing years with pregnancy. It is clear that women that develop hypertension, high blood pressure during pregnancy, and then even a more concerning condition called preeclampsia, those women tend to go on to have high blood pressure later on as they get older, and that increases risk of cardiovascular events down the road. The same thing with diabetes associated with pregnancy as well. The diabetes may go away once you finish your pregnancy, but later on you may find that you are more inclined to develop diabetes, which is a very significant risk factor for heart disease, particularly in women. Just the numbers for men with diabetes, their cardiovascular risk is 3 to 5 times higher than the normal population. In women, it's 7 to 9-fold higher, so really significant. Moving on into your menopausal years, this is when we start catching up to the men. Fortunately, estrogen provides really wonderful effects on our body. It keeps our skin young and youthful and elastic, keeps our vessels youthful too. And as we get older, the loss of estrogen that occurs with menopause, it changes the way we metabolize lipids as well. Our cholesterol levels tend to rise. We tend to lose the protective cholesterol, the HDL, and have more of the bad cholesterol, the LDL, the low density lipoprotein. Fortunately, we have great medicines to help manage those numbers. But that is, so 10 years after menopause, your risk of having heart disease is very similar to that in men. And we know around the age of 50 is when we start seeing the incidence climb. And then in the mature years, that risk exists and now is kind of embedded. And so the bottom line is, let's get all ahead of this, get back to our childhood years, create the good behaviors, be more active. I don't want to say exercise because it doesn't have to be about a gym. It's just about moving, choose to move more and make those right decisions. Build a healthy plate every time you sit down and eat.
I love that. And I am a huge proponent of teaching children and starting at a young age. I do that with my children as well. So I think that's a great lesson for all the moms out there about setting healthy habits early and setting kids up for success with their health in the same way that we teach them about success with their finances and, school, really setting them up in a way that is going to help them throughout the rest of their life. So we've all survived the past 2 years of COVID, and hopefully we are coming out of the tunnel, I think. But we clearly know that the pandemic did affect care of patients. So Maria, how has COVID, in your opinion, affected the care of patients with cardiovascular disease?
Very relevant question, I will say, and I do hope that there's a light at the end of the tunnel. And we're almost done with that. But, COVID-19 has really affected cardiovascular care and the risk of cardiovascular disease, I think, in many ways. Over the past years, many of us have adopted all these unhealthy behaviors that we have repeatedly mentioned. We are exercising less, probably staying at home, working from home, eating unhealthy foods, drinking more alcohol, smoking cigarettes, all of which we know, we have discussed now extensively, that they increase the risk of heart disease. We also know that even people who had mild cases of COVID-19 may have changes to their heart and many other organs as well due to their run-in with, this virus. And we know that these changes are not just acute changes. We're learning now that they could be even chronic changes. And there's still a lot more to learn about this. Even if we look at a data from the American Heart Association, 1 in 5 people have reported lower physical wellness since the COVID-19 pandemic, and 1 in 3 people have also reported lower emotional wellness, both of which Bella has now mentioned several times are directly associated with cardiovascular disease. So I think these past years have really affected us in many different ways, and we are seeing and will continue to see, I think, for a while, all these effects that will be reflected in the increased risk of cardiovascular disease and how the care has changed also in this area.
That was great. And Bella, Maria talked again about emotional well-being. I want to ask you, as a psychologist, what can be done and what do you counsel your patients in overall to help protect a woman's heart?
So yeah, I think there are many ways to help protect our hearts. And when we're thinking about how stress can negatively impact our heart, sometimes I get people who come into my office who then stress about their stress, which then also becomes this, another problem to deal with and makes the issue worse. Because actually there's a health psychologist named Dr. McGonigal. I believe she spoke last year in this forum, and she mentions how there's research that shows that people who know they're stressed and then think or have this perspective that stress is bad actually have higher rates of illness and death than people who know that they're stressed but have beliefs that they can cope with it, right? Because there's always gonna be stress around us. We just have to believe that we have resources to manage it. And also, so one thing that I work on with my patients is there are times when our thoughts can impact how we feel and how we behave, and viewing stress as an example, right? Instead of viewing it as just a bad thing, if we can reframe it at times to recognize that stress is also a way to energize us and mobilize us to get things done and take care of things. If we weren't stressed at all, we would never go to work or go to the doctors to take care of ourselves. So we do need a little bit of stress. So I think part of it is reframing our thinking. So related to stress is one example, but really we can reframe our thinking with regard to anything that is kind of changing our mood and changing our behavior. So that's one thing. One way that I work with patients when they're feeling stressed or when they're feeling worried or feeling down is to modify thinking. Another big area that I try to target with my patients is people who are feeling isolated and lonely, and that's actually something that we saw as Maria was mentioning in COVID-19, right? We all know that one of the ways to help reduce the spread was to give some social distance, to stay home. And in doing so, there were some people who felt very isolated and very alone. And there is some recent data from the pandemic that shows that there's a 27% increase in heart disease in postmenopausal women. There's an increased risk when they viewed themselves as being isolated and alone. And it's not just from the pandemic. I mean, the pandemic is one example, but there's other research that shows that this isolation and loneliness increases the risk and can be, a similar risk to being obese and a light smoker. So we really need to target that if somebody's feeling alone and feeling isolated. Making efforts in whatever way. I know the COVID-19 pandemic has made it difficult, but there's also been some silver linings, like we're all here today in this type of virtual setting of being able to connect virtually or to do so in safe ways, whether it's a phone call or a library, to get engaged in some way. And then I guess one other kind of thing that I work on with people is to talk about feelings, because when we hold all of our feelings in, that has a way of staying around. And by being able to talk with other people about how you're feeling, it really helps. And again, one more thing from Dr. McGonigal, this health psychologist, is that she explains that in addition to the cortisol and epinephrine that's released during times of stress, oxytocin, the hugging hormone, is also released. And so if a hormone that's released that's meant to connect other people with others is released during times of stress, it's an indicator, right, that our body is telling us, don't do this alone, connect with other people, whether it's a friend, a family member, your doctor, your cardiologist, or a mental health professional like myself.
Thank you so much. And I'm a huge believer and advocate in therapy. And I actually talk to a lot of my patients about seeking care with a therapist. I do feel like there's still a little bit of a stigma around seeking care. How do you break that down and help, women in particular realize that it's okay to ask for help when it comes to your emotional, psychological well-being, and that therapy can be incredibly impactful?
That's a great question. And I think that's, one of the highlights of Katz Institute for Women's Health, where we're integrating care and integrating it, the mental health services within the doctor's office, so that people don't have to make an extra appointment, right? So that busy women who are busy taking care of, everybody else can get those needs met also within, when they're there to see their cardiologist. And it helps to destigmatize it a bit. And I think recognizing, again, that everybody feels stressed and everybody needs a place to talk and get support. I find that helps to destigmatize it a bit too. But we need to talk about it more. And so thank you everybody for listening and participating today, because I think that's one of the important steps too.
Definitely. And you talked about the importance of connection with family and friends, but obviously it's important to be connected to your doctor as well. And Jean, I want to talk to you specifically about that partnership between the doctor, the healthcare practitioner, and the patient. Why is that so essential for wellness? And what does that mean, having a good partnership with your provider?
Well, I think, Bella shared a lot already about, the connecting to loved ones, but I would say that your partner in wellness, who's your wingman on your journey to being the best, healthiest version of yourself, are your physicians or healthcare providers. And the relationship has to be bi-directional. It has to include, listening on both sides, validating as you're listening to make sure that you're, what you're feeling is real, or and if it may not be, then to explore a little. But for sure, if you're feeling it, it's real. Like, I think that's the first starting point. We have to acknowledge that, and to create a plan of attack on, what the next part of the journey should look like, whether it's testing with diagnostic testing or medication, or meeting with a therapist to, help kind of unpack the issues that are, rumbling around in your heart and your brain, and putting them on the table and sorting through them and creating plans. So, it's a journey, and it requires a partnership to get there. We're all in New York, which I think is, a place with physicians all on every corner, every block. And so we're pretty lucky because we get to pick someone, or I'd like to think that we pick someone that kind of, meshes, that you have that good connection, that it's natural and organic and not forced, and should never be associated with feeling like you're being judged. Or you have to get this right, because there is no right. It's what's best for you. So I always, talk about the partnership in of your physician and being the patient, and being empowered to ask a lot of questions. Like, questions are a good thing. It means you're trying to figure it out, and you want to be engaged in the plan. So, if we get bad haircuts, at least for me, I don't go back to that hairdresser. I'm, off to find someone else. Ask my girlfriend, I love your hair. Whose doesn't? Let's, I want to try them out. Not that I'm diminishing anything that all of us do here, as healthcare practitioners, but, it's about finding the right person. So, if you leave an office and it just didn't feel right, it didn't feel like you were listened to, you were taken seriously, not validated, I would suggest to all of you, go out and find someone that you connect with, that it starts with trust. I'd like to think that my doctor is curious about what's bothering me, and also curious to know like who I am, what makes me tick. This is how you achieve wellness quicker. We can all get there if we do the work, but you can get to A to B a little bit quicker if you've got a good partner. And I think as we all walk home, today and have listened, like, please keep that as a priority. Your healthcare practitioner needs to be your partner, and you need to see them that way and feel good about the relationship.
I completely agree. And I think it's such good advice for women that if the fit isn't right, to find someone else, that's okay. And it's like a relationship, a marriage, right? I mean, you have to get along, you have to listen, you have to communicate, and you have to feel comfortable with that person.
Yeah. And there needs to be trust, right? Every relationship starts with authentic trust.
Absolutely. I want to jump to you, Maria. We talk a lot today. We are talking a lot about how women are not just smaller versions of men. And it also is the case that even within women, there are differences based on racial or ethnic backgrounds. So you're from Colombia and Latin America. Can you tell us a little bit about the unique impact of cardiovascular disease in Hispanic women?
Sure. I think that's another very, very important question. I think, we know that heart disease really doesn't discriminate. You could argue that it does have a bit of a penchant for racial bias, where us Hispanic and Latina women should be concerned. And there are statistics to prove that. I think on average, Hispanic women are likely to develop heart disease 10 years earlier than non-Hispanic. 1 in 3 Hispanic women are aware, only 1 in 3 actually, women are aware that heart disease is their number one killer. And there's statistics, again, from the AHA, the American Heart Association, that show that as much as 43% of Hispanic women have heart disease. 41% of Hispanic women have high blood pressure. So the rate of all these cardiovascular risk factors among the Hispanic Latino population that lives here in US is very high. At the same time, we know that Hispanic culture embraces the needs of a group or family over self-care. Hispanic women with heart disease see heart disease as something that is my problem, and we don't want to share it with our family. And I think that makes it difficult for us to get the help that we need. So what Jean was mentioning about finding a partner, a good healthcare provider to help us get where we need to be, I think it's key. It's very important for us to be proactive about our health, make a commitment to ourselves so that we can adapt all these healthy habits and prevent heart disease.
Thank you so much. And I'm so glad that we're able to address that, because I do think it's extremely important to identify the fact that there are differences and how we can begin to approach that. Bella, I'm coming to you now as we're kind of wrapping up and hoping that you can lead us all in a little bit of a meditation. I know I use meditation myself in my family. I definitely talk to my patients about it. So before you lead us, if you can just explain a little bit about how meditation actually works to help us, and then walk us through.
Yes, definitely. So meditation helps by, remember we were talking earlier today about stress, and stress works by releasing the fight or flight hormones of epinephrine and cortisol. And so what meditation does, it helps to shut off the sympathetic nervous system, and it turns on the parasympathetic nervous system, which is also called the rest and digest system, which helps to slow down our heart rate. It slows and stops the release of the cortisol and epinephrine so that our bodies can calm down. And when our bodies calm down, then our minds can calm down too. So there's a lot of research on meditations and how it can help physically lower blood pressure. It can help reduce stress. It can help improve sleep. pain. There's so many areas in which it can be helpful for both our body and our mind. And there's research that shows that it leads to changes in the brain. So the brain makes new and different connections, which is important. It can help reduce those inflammation markers. So again, it's so important. And I'd love to lead everybody in one of my favorite meditations today. It's called the loving kindness meditation. And again, it's important because it helps to decrease anger and stress and increase empathy, which I think is something we could all use a little bit more of in the world. So without further ado then, if everybody would like to get into a nice comfortable position, uncross your arms and uncross your legs. And you can either keep your eyes open or closed for when you practice meditations. If you want, you can keep them open because we want you to use this when you're living out in the world, and we live in the world with open eyes. So if you want, you can keep your eyes open, just pick something maybe to focus on, whether it's something on the wall or on the floor. And I myself might close my eyes for part of it or open it. So again, do whatever you feel comfortable with. Okay. And we'll start the meditation by taking 3 nice deep breaths, breathing in through your nose and slowly exhaling out through your mouth. And again, inhaling in through your nose and slowly exhaling out through your mouth. And one more time, inhaling in through your nose and slowly exhaling out through your mouth. And I want you to keep breathing at a pace that feels comfortable for you. And in your mind, I want you to imagine somebody who you know loves and cares for you unconditionally. Maybe it's a partner, maybe it's a spouse or a doctor, somebody that you know cares about you. And imagine them saying to you, may you be happy, may you be healthy, may you live with ease. May you be happy, may you be healthy, may you live with ease. And it's okay if you don't remember all of the words. If only 1 or 2 of those words stick out, you can repeat those to yourself. And just take a moment to sit in that love and kindness that you've received from the person you care about. Allowing that love and kindness to envelop you and to emanate from your heart to the rest of your body, to every cell of your body. And in your mind, I want you to now say and wish loving kindness to yourself. May I be happy. May I be healthy. May I live with ease. May I be happy. May I be healthy. May I live with ease. And I know sometimes it's not easy to give love and kindness to ourselves, and that's okay. Don't judge it. Just try your best in this moment to give yourself some of that love and kindness. And imagine that love and that joy spreading throughout your body, above you, below you, to your right side, to your left side. And on your next out breath, imagine that you're going to send this loving kindness to somebody that you care about. Could be the same person who you imagined before, who you know loves you, or it can be somebody different, somebody who you think might really need it today. And imagine saying to them, may you be happy, may you be healthy, may you live with ease. May you be happy. May you be healthy. May you live with ease. And imagining that loving kindness enveloping them as well, and giving them that love and that joy and surrounding them. Now, on your next out breath, I want you to imagine in your mind somebody who you feel neutral about. Maybe it's a person that you pass on the street on your way to work, a person at the deli store, a neighbor that you just waved to. And imagine sending the loving kindness to them, saying, may you be happy, may you be healthy, may you live with ease. May you be happy, may you be healthy, may you live with ease. And on your next out breath, you can imagine now our loving kindness continuing to spread to the whole world, to all plants, to all animals, to all people. Saying in your mind, may we all be happy. May we all be healthy. May we all live with ease. May we all be happy. May we all be healthy. May we all live with ease. And as you continue to breathe, just taking a few more moments to enjoy the love and the kindness that you've generated for yourself and generated for others. And knowing that you take that with you and can share with other people every day. And when you're ready, you can slowly open your eyes to a soft gaze. You want to stretch a little bit and bring your attention back to the room. So Tara, Maria, or Jean, any thoughts about the meditation?
That was amazing. I feel so relaxed. I think what's so powerful and is that even just that 5 minutes of doing that totally makes you feel different. And I think for so many people, they think they have to spend, an hour meditating a day or 30 minutes. And even just those small chunks of time can be really incredibly powerful in terms of changing how you feel.
Definitely. And, I know for myself, when I practice meditation, sometimes my mind does wander to other things, and that's okay, right? We're not expected to only think about one thing. Our minds are built in that way to think about lots of things all the time. So I think it's about just remembering to bring your mind back to the moment. And even if you have to do that 1,000 times, not to be discouraged, that is the practice of meditation, and you'll see the benefits if you keep practicing.
Well, that was really fantastic and very special. So thank you so much for leading us through that. And thank you to all of you today, all of my incredible doctor colleagues, for this superb discussion covering the many aspects of heart health. Thank you to our audience for your attention and interest and for meditating with us. We appreciated all your questions and hope that every one of you has learned something new about the brain, heart health, and the importance of emotional health when it comes to the heart. Remember that knowledge is power. Being aware of the risk factors for heart disease is vital for everyone. This will allow you to take the steps necessary to make sure you are heart healthy at every stage of life. Be sure to tune in to the other conference sessions, and we hope that the rest of your day will be wonderful. Thank you so much.